Hello, welcome to this webinar covering Pharmacy First and Pharmacy Services. I'm Dr. Vijay, one of the GP leads in the North West London ICB, but also one of the GP leads for NHS England, the London region, covering digital transformation. So this webinar is really designed more for reception and admin staff who might need to navigate patients to pharmacy services. Let's start with a video.
I jumped up this morning with the sun down, shining in. When I met myself crawling out as I was crawling, I got up so tired I couldn't unwind. Saw so much it blew my mind. I just dropped in to see what condition my condition was in.
Now your pharmacist can provide some prescription medicine if needed without seeing a GP. Just think Pharmacy First.
You might have seen that recently or some of the materials from that campaign. I'm going to show you another video which is a bit older.
It's Greg.
Take the drama out of minor illnesses. For expert advice, speak to your pharmacist.
I must admit, I really like that second video. So, Pharmacy First and Pharmacy Services. The message is really clear that both our patients and us, we could be using them more. Our patients' needs can be met in a pharmacy and not by us in general practice, and that we often don't think about navigating them to pharmacies as much as we could. So here is a slide that just shows you all the sort of things that pharmacies can offer to our patients. This one gets a bit confusing around the branding. So on the left-hand side, you've got these three parts which are part of Pharmacy First. And the right-hand side, there's a list of other things that pharmacies can do which are not under the Pharmacy First branding and just really pharmacy services. So if we look at the left-hand side, we first got clinical pathways. So this is a new element that comes in with Pharmacy First. And there are 7 conditions or problems or symptoms which patients can self-present, self-refer to pharmacies for help. And also we can, in general practice, either signpost patients to go to the pharmacy or refer the patient to go to the pharmacy for those 7 clinical conditions. We'll cover that later on. The second component hopefully is a bit more familiar. This is minor illness. Hopefully you're familiar with CPCS, which has been running over the last couple of years. So the Community Pharmacy Consultation Service effectively gets rebranded to become part of Pharmacy First and that minor illness pathway. So these are for sort of minor conditions, minor illnesses that we can refer patients to. What's really important here is we must refer the patient to the pharmacy for this service. Patients can't self-refer for this. An emergency prescription is something that actually we'll pick up, but really for us in general practice, we're not really meant to use. So we probably just be aware that it exists, but not something we're meant to actively use. So this is the whole Pharmacy First branding and bits you need to know about. But then on top of that, we've got all these other pharmacy services, which can get a bit confusing. So there's a blood pressure check service. So patients over 40 who are not known to have high blood pressure, we can get them to pharmacies to do blood pressure checks, but not just blood pressure checks. They can do those 24-hour blood pressure monitors, ABPMs, if it's felt to be indicated. So that's something you may not be aware of. If you have a pressure, your machine's booked out for ages, that's a service that could be useful. Contraceptive pills. So if patients have either never had a contraceptive pill for the first time or they need to repeat, we can use pharmacy services for that. Emergency contraception, so things like the morning after pill, there are pharmacies that offer that service too that you may not be aware of. New medicine service, this is something you may not be aware of, but they can pharmacies can get involved with supporting or giving advice or follow-up for patients that have had a change in medication or new medication service. You're probably aware that I think we're all aware that pharmacies offer flu vaccinations. That's nothing new, and some patients are eligible for still COVID flow tests on the NHS. They're just some of them. So there's a whole array of things, and we're probably going to focus mainly on Pharmacy First, but we're going to touch on some of the pharmacy services. But just being aware of this whole menu of things is really our starting point as what we can do to direct patients away from general practice. So what I'm going to hopefully cover is a quick overview of Pharmacy First. So more on the Pharmacy First side, but we'll may touch on some of the pharmacy services on that right hand of that slide. How do we refer? How do we signpost using our SystmOne? How do we get consultations back from pharmacies? And then what can you do in practice to sort of promote this service, and where can you find stuff? Okay, so here we go. So we start with that overview. Now, I'm not even going to bother covering this. We'll share these slides. These are all really long documents. We don't have time for this. But the key message is this. The plan from the NHS is, if we put resources in pharmacies, get them to do things, make use of their skills, can this reduce the pressure on general practice? That's the summary of all of those lengthy documents. And that's what led to Pharmacy First. So it was launched on the 31st of January, but it was an extension and rebranding of the Community Pharmacy Consultation Service. You might not be aware, but it actually started in 2019. Originally, it started with 111 referrals. Urgent care was the first system that referred to community pharmacies. Then you might remember, some of you, that in December 2021, I did some webinars where I tried to train about how to use CPCS. But this is probably one of the most important difference to us, that patients can now self-refer to most services without needing GP refer. I think all of us obviously had that frustration about referral, and how long it takes to click boxes on SystmOne and send things through. So there's a balance about this, and we'll pick up the pros and cons on referral and signposting later on. So what are the three elements of Pharmacy First? So clinical pathways, that new element of 7 pathways, which we're going to go through in more detail next. The minor illness, which I reminded you already about, it's like the CPCS type broader range of conditions, but importantly, they must be referred. And this bit, just to be aware of it, that patients, when they run out of medication, there is an urgent repeat medicine service. So pharmacists can, patients can almost refer themselves, one can refer them to that service, and pharmacists can issue those supply. However, we're really not meant to use it ourselves, because we're meant to issue the prescription ourselves, and it is an expense and cost to the NHS when you use it. So it really is an urgent emergency use when practices can't issue a repeat prescription fast enough. So that's what's happening. Randomly with the clinical pathways, there are also distance selling. You may be aware of online distance selling pharmacies that sometimes they can still offer this, but they can't offer all of it. There is an ear pathway, which we mentioned, where they really do feel like you need to examine the ear, which obviously can't be done online. So what are these 7 pathways that we need to know about? So this is where it starts to get a little bit confusing, and I think it's a learning curve for all of us. So if we just remember the headline, so UTI, but importantly, that only applies to women in this age category, where we think it's like the early stages of a urinary infection, not that they're that unwell. It's spread wider in their urinary system. Excludes pregnant people, people with catheters, people who've had recurrent urinary infections recently. So even if we signpost, if we just said to anyone, "Oh, you've got a urinary infection, go to the pharmacy." Obviously, if we get this wrong, if we signpost a male, they've got no chance; they'll be sent back. But if actually they've just recently had a urinary infection that we treated in general practice, that could also lead to them. If we've had a couple of episodes that the pharmacist says, "Sorry, I can't help you. You've got to go back to your practice." So we do have to start to really understand some of this, and I appreciate it's going to take time, but this will make sure that the patient experience is right and that we don't all get frustrated that things keep going around in circles. Sore throats, maybe a little bit simpler, so it's just more about age category 5 and above, but again, not pregnant individuals. Sinusitis, so again, it's more about over 12-year-olds. And some exclusions. So really, symptoms that have gone on for a long time, or younger individuals, are people that can't be referred to the pharmacy. Ears, so painful ears, potentially an infection. So really, this is for children age 1 to 17, and not though if they've had multiple episodes, or if they happen to be pregnant and they're under the age of 16. Infected insect bites, again, children or adults over the age of 1, but excluding pregnant individuals. Shingles, so that's a rash that that you may be aware of, and this is for often presents as a rash. This is again for adults, excluding pregnant individuals, and impetigo, a skin rash, which can be directed to pharmacies if they're above 1 year old. and excludes though if it's quite severe or they've had lots of episodes. So this, I appreciate, still can sound a little bit confusing. Who does, how do I remember all of this? How do I, remember who's appropriate, not appropriate? So I think it is a learning curve for all of us. And I don't know if people want to post a chat how they're finding things at the moment. And this is a grid that kind of captures that all together with potentially even a little bit more detail. So this might be one that we want to print off, leave near reception as a quick aid. We've also included this into the SystmOne templates now, so you can actually see this. And I do think it is challenging still. It has got lots of information here, but the closer we get to this and understand this, the more appropriate we are going to be about sending the right people across. And I imagine this will evolve over time, and we can. But this is probably your best guide at the moment. One thing that may be a bit confusing to you is you may think, well, look, there's some extra bits here that we didn't cover in the slides before that. What happens is this also just tries to increase the chance that the pharmacist can actually help, that that the pharmacist doesn't feel like it's out of their depth, that they have to send them back to the GP or somewhere else because that patient's not appropriate for the pharmacy first service. So this detail goes another layer further to help get that patient to the right place. This table you might have seen before. This is really the CPCS service rebranded. So it's now that minor illness pathway. So again, common conditions, common things that we deal with every day in general practice. And the green is obviously what's suitable. Patients are suitable to be referred to the pharmacy, and red is what's not suitable. So hopefully this is a bit more familiar to you if you've used CPCS. You can see there's also a bit of overlap. Those 7 pathways do overlap. How do you know which is which? If you did refer a patient as a minor illness and actually they were one of the 7 clinical pathways, the pharmacist would just manage them as appropriate. But the most critical thing is that for all of this, you still need to refer. You can't just tell the patient to pitch up to a pharmacy. So that's a big difference between the clinical pathways 07, which you can signpost, refer, and minor illnesses, this bit, which is like your CPCS and hopefully more familiar, but does need a referral. Now, this looks really complex, and I'm not expecting anyone to look at this or read this, but I just want to give you this as an illustration of what the pharmacy is doing. This is the process that they have to go through. So when they assess the patient, they go down these sort of checklists and so forth, and they have to hit what we call a gateway point. If basically the patient meets those criteria and passes the gateway, they can continue offer a service. But if they don't, that patient often gets referred elsewhere, either back to GP or to another service. So if we get the inclusion and exclusion right, it's more likely that the patient will pass this gateway check. We don't probably need to know the detail about how a pharmacist gets paid or not, but this is also one difference about signposting and referral. If a patient just pitches up to the pharmacy, often that pharmacist only gets really funded for dealing with that patient if that patient passes that gateway check. If you referred a patient to that pharmacist, it doesn't really matter. Even if you did it inappropriately, that pharmacist will still be funded for their time because you did a referral. It was our either us not understanding what is possible or not. So this is this checkpoint here. And I don't expect anyone to know the detail, but just to understand that this concept, that it should be kind of more standard or consistent across pharmacies, that they're all trying to follow these sort of same pathways and protocols. And even if you ever get onto confusion where you don't know why they
Prasanka, you're muted.
You're muted, Shankar.
Shankar, we can't hear you.
Hear you.
Okay, so can you hear me now?
Oh, here we go. Yes, we can now. Thank you.
Okay, sorry. Someone I think did it. Yeah. So I don't know if you Surrender, did you have a question?
Yes, Shankar, sorry. I joined late, so this might have been covered. The pharmacist, patients, do they have to pay for their medication via either of the 2 pathways?
If they normally pay prescription charges, then yes, they would pay the prescription charge. If they didn't, then it would be like as normal.
Sure. Okay. Thank you. Thanks.
Okay. Right. So look, I'd also say, look, we've also already covered quite a lot of complex stuff about inclusion and exclusion. So please do jump into the chat with questions at this stage. so that you are aware of what we can pick up some of those questions now. So anyway, so why is it important that we do use this? So
sorry, Shankar, can we
yeah.
ask you to share your screen again? For some reason, it's not shared anymore.
Okay, let's go again.
Thank you.
And can I just check, did you just lose it there, or was it further on that you lost?
No, we just lost it there. That's fine.
Okay, wait a second. I may just need to go through. Okay, so we're just going to scroll through. So this is aid memoir.
Teams is great when it works.
No, it's more actually. Yeah, well, we'll go into it. It's always when you're in IT, you actually have more IT issues than anyone else. So it's just the way that the world works.
That's so true.
The more you're meant to be. Yeah. Anyway, so why are we meant to use it? So this is meant to help us. I know that you guys in reception may think that this is not helping me. I've got to do all of this extra stuff. But generally, when you're trying to find appointments and things like this, this is meant to put the patients that can go to the pharmacy first and then give more slots for all the other patients. That's the gist of it. But we're also really trying to change behaviour. Yes, we may have to refer or signpost the first time, but surely if they start to understand that pharmacists can do these things and they even learn those 7 pathways, will they just go directly to the pharmacies and not even contact us to begin with? So we get to start to train them. Do they start to have more confidence in their pharmacists? I mean, pharmacists are clearly highly skilled, highly tried people, but people's perceptions of them can be completely sometimes wrong. They don't understand their abilities, their skills, and it may just change their relationship, that they understand that they can get more assistance and help for their pharmacists and understand that they can prescribe things. So it can change their role, and really change our role with community pharmacists, that we see them more of our team, improve our relationships. Like everything in life, we could always do better as a team. Can they do this? Well, yes, they can. So more than 95% of pharmacies across England are already set up or signed up for it. And I think the figure that Cam said at the moment we are in Ealing is about 96%. So I think we've only got like 4 pharmacies that aren't yet. And I appreciate we have cross-boundary issues and stuff, but you can just broadly think that more than 95% are. So you could pretty much assume that a pharmacist is doing it and accept an error rate that you might have forgotten them, or you've just checked with your local pharmacies and be aware of the ones that aren't happen to be doing it at the moment. They have funded it. We're not going into the detail of this, but just remember that that thing about if you signpost and they're inappropriate, they don't get funded for their time as much. If you refer and it's inappropriate, they'll be funded either way. So you can see from their perspective the pros and cons of referral versus signposting, and which we'll pick up later on. Sorry, we've got a. Is there still nothing on screen?
Yeah, Shankar, there's still nothing on the screen, but obviously verbally it's very.
Okay, let's
the rest
try
of
to
us.
do some.
I can see it. I can see what's on screen.
Yeah, I can see it too.
Yeah.
I
So I
can
think
see
it might be your internet connection.
Okay. Can I suggest this? I'm going to continue with this because this is if there's a mass if people can't see my screen, just put it into the chat. We'll work out. But usually this is the most reliable way to share. So let's see. Are you all okay? So maybe it's just but we'll carry on. But one thing I just want to mention is that, like in general practice, we have pressure on workload, staff off sick and etc. Things can happen obviously with community pharmacies. They can be relatively small organizations and services. So there is that relationship. There could be bumps in that journey. And, if you do see tensions, if you still see issues, try to obviously discuss it with them, say what's working, what's not working. If you need to escalate, you can involve, the ICB, the medicine management team. We'll try and work out what's the best way. Often PCN level, there could be discussions as well. But, they are able to do this as well. Right. What about bounce back? So to give you the assurance that 9 out of 10 patients actually do have their whole care completed by the pharmacist. So you may think that they're bouncing back, but remember, you probably only see some that you refer. There's a lot of that self-presented, and a lot of the time the bounces are actually valid. There's definite reasons that we may not have picked up in the referral. So it's not that it's completely failed. It's actually that they're following the pathways that they're meant to follow. So it might be that, even if there's a view that those pathways may evolve or those protocols may evolve and it changes, but I think we could just go think through that. If you are seeing a high level of bounce backs with a particular pharmacist or pharmacy, maybe you just need to discuss it and then obviously involve others if you feel that there's something that needs deeper discussion. Okay, so we've covered hopefully an overview of the service. I now want to go through referral and signposting. So we're now going more into the IT bits. So anyone that contacts a practice either by phone, online, or in person can be referred. It doesn't matter how, maybe an online consultation they're submitted that you want to direct. And really, we're saying that anyone who makes appointments or books patients in should really broadly know about Pharmacy First, because they could think about either signposting or referral in. And this is like it doesn't really, this diagram doesn't really doesn't really gain much from it. But the main thing is at the moment we're probably going to pick up how do you refer using NHSmail, but the future are things like this, like different IT systems, which I'll pick up in a moment. So when a patient when a patient might be considered for referral, we've got to check with them where they want to go. We can't make assumptions, and I'll explain that why in a moment. And we're going to talk through the process of using NHSmail to send that referral, and probably we'll communicate to the patient something like this: that following our discussion, you've been referred to your chosen pharmacy for further assessment. Please contact them if needed, and here are the contact details. Well, if you do need to share them the details, but this bit of safety netting that if they encounter problems, can they come back to us at practice, is probably the bit that you need to flag. But the key thing here, that encourage them to contact the pharmacy so that there's no delay. This is meant to be a same-day service. That busy pharmacist may be a delay before they see that referral come in, or they've noticed it. So if the patient contacts them, it might just highlight it to them as well and make it a smoother experience. Here are some other phrases that you may or may not find useful to communicate to the patient. So, like having listened to what you've said, we're arranging a same day. So just emphasizing the same day consultation, and really that the community pharmacy is working with the practice. It might just make it more acceptable to the patient that they don't feel that they're being fobbed off by us as general practices, that they're being sent to an extension of our service as a practice. And really to explain that they can issue prescription-only medications. They may be thinking, oh gosh, I need an antibiotic. My pharmacist can't do that. Well, the pharmacist can issue often an antibiotic now under this Pharmacy First service. That's one big change that comes in with it. And that is if it is appropriate, though. So it's not saying that they're going to get it all the time. And then this about the environment. They may not be aware that there's, pharmacies have separate consultation rooms. They may be worried that they're going to be talking over the counter about something quite personal. And they may not be aware that, sometimes they can have an examination from the pharmacist. That may be something they've never been used to from that. So some of these messages could be useful to explain to the patient. So this is the bit that we do need to understand. So we're busy in general practice and reception. You need to get onto the next call. So you may just say, well, look, go to this pharmacy. You may also have a really close relationship with the pharmacy next door, but we can't influence unduly the choice of pharmacy. And you can't even introduce subconscious bias. Like if you thought that pharmacy is better than that, really got to be careful. They're all businesses. There is, we can't use, and we're influential in general practice. We can influence these patients' decisions. We're not allowed to do that. So you should really generally suggest the one that they're nominated for already if they're set up for EPS. And if not, generally offer them the one that's closest to the preferred location. That will avoid any tension with pharmacies, and it follows professional guidance for general practice that this is an agreement. So just be careful about how you manage that choice and that selection. Who do you know how to refer to? Well, you could assume that it was practically everyone and then accept an error rate. But like we said, probably a couple that you don't know that aren't set up. You probably know them because they're local to you. If you do need some help, with the message around team stuff can give you the updates on the ones that are not set up in SystmOne. The ones that are in the address book, which we'll touch on in a moment, are generally taking those referrals. There's also a web site called NHS Service Finder. Now, this is something that is genuinely useful to know about. I know there's a lot of NHS products and things that you start using thinking, oh gosh. A few years ago, I wouldn't have promoted this to practices. I do think it now has a value, but what I do accept is that when you're a busy receptionist, logging into something and trying to click through it is not necessarily something you've got time for. It might be that certain people in the team are aware of it and see the value, and then you may find it useful in particular cases. And it's also important to know that this is a two-way thing. Pharmacies will use this to find your details. And the scenario where you may need to use this is, what if our patient did actually see some random pharmacist outside a normal area near their workplace, and there was some report we got back and we didn't understand how to contact them. You can find bypass phone numbers, bypass email addresses, things that you can't find through this, and you can do a lot more through Service Finder. It really is quite user friendly, and you can search for pharmacies who offer particular services too. So I'm not going to go into the detail of this, but I have done a video. It's still a few minutes long, this video. QR code and links here, we'll share it. So if someone in the practice does want to look at it, understand how to use it, I do recommend at least one person in that reception admin team is aware of it. So what's the patient journey? We've said they contact the pharmacy. The pharmacist will probably either ask questions, they may may assess them. Some pharmacies are actually doing this online as well. They actually send questionnaires to the patient, a bit like us sending our two-way questionnaires to patients. So some of them do that as a screening tool. Some of them get them to do a questionnaire when they turn up, that they get one of their assistants to start gathering information for it. So it's not always that they go walking in and straight away get a face-to-face. That pharmacist may also be busy. So just be aware of a little bit of that variation. And again, some of your discussion with local pharmacies, you may understand a little bit more about what they do. Like we said, we need a referral for minor illness and those 7 pathways, which we mentioned too. And that key thing about sometimes, if appropriate, it may lead to an antibiotic. Right, this is a demo of sorry, I'm not going to show you this now, but I've just refreshed that video literally this morning because there's been some slight tweaks. So you may have seen a previous demo video I did in December last year. I've just tweaked it, updated it this morning. So we'll share the link and that video. It's a walkthrough video for some of this, but I'm just going to go through a couple of slides here, which may be a bit quicker. So how do you find things on SystmOne? So there's a template. If you look under auto consultation, pharmacy services, pharmacy first, pharmacy services. I'd hope that a lot of you are familiar with that or know it kind of exists. You can also find it from the search bar. If you search for pharmacy, you can find that template there. So that template helps you with both signposting and referral. So signposting, these are a list of pharmacy first and also pharmacy services. So when we mentioned about blood pressure, contraception, a lot of them are listed here. And these are the preset messages that I've set up in SystmOne using the communication annex to send the messages for you. So if you click a button, it will load up the best message to send to that patient. And it's actually further refined here. I've done even more optimal messages for the different pathways. The logic here is intelligent signposting. We're busy. You may not explain all of it. Like, for example, impetigo. How on earth would you know if that patient has impetigo or rash? You're not seeing them over the phone. You either could ask for photographs, but we're not clinicians. If we're in a reception admin, how do we know if that's appropriate? Sometimes if you send them a link, so for example, things like impetigo, you might think it could be appropriate for them. They hit the NHS webpage using the message that we send them, and they might see pictures on the webpage, might see it's appropriate, and it guides them through a bit of information. It guides them through the expectations they can have, like even if it's a urine infection, what can they expect or not from the pharmacist? So it does a bit of our work for us with the signposting to relevant sections of the NHS page. So I'm calling this intelligent signposting, not just, I'll go to see your pharmacy. It's give them a link that they may use that link and they get more information through the NHS webpage. So actually there's less likelihood of inappropriate patients turn up. If, for example, you forgot to get the age right, which age is appropriate, they may see that on the webpage and realise who's appropriate or who's not. So that's some of the signposting bits there. If you go to the clinical guidance tab, and this isn't something that I've added that's relatively new, that whole table that I showed you earlier on, I've put it in there as well. So you've got it quickly at reference there. So you can toggle there, quickly check if you're having a conversation about, is it appropriate or not for that patient. So hopefully that's a bit of help. So that was the sort of pharmacy first, the clinical pathway signposting. Now I'm going to look at the minor illness referral pathway. So this should be familiar to you. It's like CPCS. So you just click one of the conditions. You can also use this for some of those clinical pathways if you wanted to refer a clinical pathway, not just signpost. And there's a lot of overlap. You could tick something here as well. And once you tick it, you click OK. Remember to check that they're not falling into any of the red categories. As a gist, I basically think, first of all, don't overthink this. It's what you were doing before to an extent as a reception or admin team. Are they really, really sounding extremely ill? Can they wait? this is a same day service. Even if you got this wrong and they saw the pharmacist and they were too unwell and they bounced back to us, was this the patient that you might have booked in for the next day anyway? So it actually would have made no difference. So just a sense check of this red category. But there are safety measures, particularly if you tell them to contact the pharmacy early and they get us early assessed. Even if you get this slightly wrong, it shouldn't be a major clinical disaster, but just have a sense check of this. But ideally, obviously, you want to get this right. And here are the reds here as well. So once you click it, you're probably familiar with the address book. You click on the address book as it prompts you. Now, when you search for the address book, so if you go into search, look for Ealing Pharmacy. You may have been previously searching for CPCS. That's what you're going to look for now. It'll list the pharmacies. I've redacted the email addresses that are here, but obviously the email address is all set up in NHSmail. So you choose the one you want. If you've got time, the next screen, just toggle it to, it will come up as hospital. If you can toggle it to community, great. If you don't have time, fine. Just click away with write the letter. And this is the referral form. Very small tweaks again at the top. You've got the links again for signposting. You've got further guidance on the clinical pathways, a bit more the red and the green. So just helping you to make sure that it's appropriate. It should autofill everything here. So usually if you've clicked something on that template, it's just going to populate here. But if not, you've got a box to fill in there or box to fill in if you want to put in any more information. But usually this is all preloaded for you now. The final page is just a contingency page. Occasionally, like a pharmacist might use this. I doubt you'll probably find any pharmacist use this, but it gives an option if they wanted to complete something like this to send back to the pharmacist, send back to the practice after they've seen the patient. Once you've completed the form, and by the way, I know this is probably for somebody really, really familiar, and you do this day in, day out, but just going through this, but say this is really basic, sorry, but you click on final version, so it finalizes that form. And then once you finalize it, you can right click over the form now that it's in tab journal, click on send via email. You click on existing contact when prompted. Again, hit the search bar. And again, it should already highlight the one that you already clicked before for pharmacy. So if you just click on it again, and then it wants you to confirm that you're sending it to that pharmacy. So you're just clicking on that, yes. And you might want to just write one bit in the email. So maybe pharmacy first referral, if you've got time, just in the email's body, and click on OK. And then we're clicking again on OK, because it's basically just telling you that when you save the record, it will send a referral. So just remember to send it. So that may be quite basic. You're probably either familiar with that, but there may have been some very small tweaks to that referral form and that template that may be new. So you may just want to familiarize yourself with it. So I recognize that is clunky. That's lots of steps. I'm not suggesting we want to do that long term. The second option that you could do, so it's definitely pick up the contact. It is, some people, if you're really fast on the mouse and things, you can do this really fast, but I agree with the feedback that is a lot of clicks. There are some advantages with it, which is that you do see those prompts, those inclusion, exclusion criteria, lots of stages. So it may mean that you're making less inappropriate referrals or signposting. So this is the second option, which is definitely less click. So I guess a lot of you are using Accumail. If you're not, it's something that is currently free as part of the Accurex offering, and you can, if you're not activated, you can get activated for it with Accurex. So if you click on sending an email, usually on your first screen, it's already got Pharmacy First Services as a quick action. So you can click on that. And really, it gives you a very rapid email structure template, very simple. And probably all you'd probably alter is this bit of the email, which is what is the reason you're referring for. And Accurex, if you haven't seen already how their directory work, it has kind of a whole community population type approach where everyone can add to the directory. And so if you start typing in a pharmacy, you'll probably find it. It'll probably have the NHSmail address for it. If it isn't there, it'll prompt you for it. So the only bit that I think is a bit fiddly here is you could easily send it to the wrong pharmacy by not really feeling familiar with the names or the email address. So I think what you should do is, if you're using this approach, is make sure you're familiar, that you're checking with the common pharmacies that you're using, that they're all set up and you're definitely correct, sending it to the correct pharmacy. So that's the only bit here, but it is just a couple of clicks. There's no form. You're just sending an email. The email counts as that you've done a referral. So that's a second quicker method that you might want to explore. You could obviously do even a hybrid. If you did do a form and you want to send it by Accumail, that's obviously an option that you may consider. So what's the pros of signposting versus referral? So signposting, maybe it's more the behaviour we want from patients, that we are telling them to go to the pharmacy, that we're not having to rely on us to do a referral. But on the flip side, you know, the signposting, it does require, you know, patients to maybe sometimes navigate the NHS website, understand the pharmacies. It can be difficult with communication barriers and so forth. So referral avoids some of that difficulty with signposting. So signposting definitely easier and quicker for practice staff. So I can see that. But it may not be easier in terms of if the patient bounces back because we didn't do it correctly, or we got a frustration from patients about why did signpost me to this? It wasn't appropriate for me. So that can be the flip side of that. Referral is essential for the From Minor Illness service. You don't have the option to signpost for it. So that's one time you do need to refer. Is it easier for the patient to navigate the choices? I would say yes. It could be that they contact the pharmacy and then actually find that that pharmacy is busy or can't help them. If they know how to signpost, how to use the NHS website and so forth to find pharmacies, they can navigate that more themselves. Pharmacies can kind of switch themselves off the return of being offered as an option if they got overwhelmed. It's a bit clunky. I think you've got to assume that also pharmacies may not act fast enough to say that they're busy, they can't take referrals. So there is some pros and cons with that. It's not perfect. The referral, sometimes it's a better experience. The pharmacist knows to expect them. They've got their details. So when they call up, they can see it. It's a more planned approach. So definitely can have a better experience. And the money side, you know, their contract, even if we did something appropriate, pharmacies would always be paid if we got referred, even if we did something appropriate. So they're not going to be as frustrated with us if we did something inappropriate. They could be more frustrated if we signpost lots of patients to them that are inappropriate, they don't get paid for, and that take up their time. So just be aware of that tension. And like I said, the bounce back could be higher in signposting, but we'd refer clearly more time, more workload to manage. So these are the pros and cons.
Hi Shankar, we've got
Yeah.
a question in the
Yeah.
chat. Pavan has asked, is there a limit on Accumail like Accuex SMS?
No, absolutely no limits at the moment, but let's be cautious about this. So Accumail is a free product, a free platform. So even in 2 years' time, at the moment we're funding the Accuex license for 2 years' time. At the moment, it's free, even if you didn't have an Accuex license. But I think it's a very powerful. Obviously, like Accuex, if you've seen, it's a very powerful tool. Once you build it, once you create it, who knows about the future about charging? But you wouldn't expect them ever to charge per message because they're using NHSmail and there's no charge to it. So it's not like SMS where there is a charge that has to be paid to a provider. So I think the only risk in the future is, do they start to charge for the functionality as a license? But at the moment, they're saying it's free. So go with that basis as you wish. This slide, it repeats some of the themes that we said before about, you know, the patient experience. There's also data flow. There's more tracking with referral. The system or the formal NHS position is please try to refer. I appreciate everyone may want to interpret it differently about signposting and referral. I can definitely see pros and cons with it, but just be aware that the system would prefer that. The pharmacies also in the future would prefer it also because they just have all the correct contact details, you know, because we pre-populate that form. They don't, you know, easy to identify the patient as well. Okay, I'm going to show us this video. I try not to show too many, but this is a patient experience of signposting.
You might receive a message like this from your GP practice explaining how you can get a free blood pressure check at a local pharmacy. So if you tap the link in the message, it opens up an NHS web page, and if you scroll down, it explains who can get a free blood pressure check, so you can check it applies to you, and what happens when you get your blood pressure check done. If you scroll further down, you may find some other useful links below. But if you go back up and tap on the green start button, and you can type in a postcode to search for a local pharmacy to there. And then you could tap on the green search button, but I'm not going to do that because it may be quicker to tap on the use your location button. And then you get a request to allow the web page to use your current location from your phone. If we tap on allow, and there you have it. You get a list of pharmacies that can offer a free blood pressure check based on your location. And they're listed in order of the closest being first. And if you look at each one, you can see if it's open right now. and you can see their contact details to arrange for your blood pressure check. And another useful tip is if you tap at the top for services open now and tap on apply filters, this will only now show you the pharmacies open right now. So that's how quick it is to get a free blood pressure check at a local pharmacy.
So the reason I spent time on that video is if we understand that patient experience of that functionality over time, we can understand where actually some of that signposting is quite good. It launches them into that functionality, does a lot of that work, explains it to the patient. It can save us time when we're really busy. But that's not on every pathway. That's where it gets confusing. So things like contraception, blood pressure check, I think the experience is really good like that. And you can feel comfortable. But clearly, the whole digital exclusion, whether for certain populations that they would find that difficult. So just if that's some of that signposting, if we look at pharmacy services, that web page, on the NHS website, it's got those different flows. So the blood pressure check one I just showed you there on that video, the contraception one is there, flu is similar, but the other ones, the clinical ones, it's slightly not well built. It doesn't really completely search it. It's not as good an experience as you just saw there with the blood pressure. So here are the preset messages that we could use for signposting, and these are all built for you in SystmOne. I've added in the communications annex. So you don't need to remember that, but just to see the gist of the wording, this could be a top level one about all the 7 pathways, and it kind of takes them to that page on the NHS website so they can understand a bit about it, understand a bit about the ages. So it does a bit of the work for us. So it could be very gentle signposting that uses that. And then for each different pathway, if you did give them that link directly to that, they just get more information. So it kind of guides them there. So if you as a receptionist, I'm not even sure if it is this or that, it can help them talk it through, and you can manage that relationship maybe a bit more with them. Saying, "Oh, it sounds like this. Do you want to look at this link and see if the pharmacy could help you? And if not, come back to us." So this could be very gentle signposting there. And for each pathway, you've got something similar: sore throats, earache, impetigo, infected insect bites. Quite difficult to work out if it's infected or not over the phone. So again, that guidance can help the patients navigate that too. Shingles and UTIs. So that is what I call intelligent signposting. We're not just saying go to the pharmacy, we direct into something where they can kind of think, does this apply to me or not? And hopefully the pharmacies will be less frustrated if we send in inappropriate stuff to them. My illness. So this one is that referral one. We talked about it as a CPS one. So this is a standard message. If you had done a referral, you may want to send something like this. So you're just saying to them, "Oh yeah, we've referred you to them. Please contact them." And they can find contact details here if they don't know the contact details of their pharmacies. And again, it does that safety net. If they have any issues, contact us back, so they don't feel like they've just been pushed away, and they understand if issues arise, they can come back to us. So that could be something that's useful to send if you do make a referral, but it does emphasize the contact them bit, so you've definitely captured that you told them to contact the pharmacy. This is that blood pressure pathway that I just showed you. So I do think this is really useful. Pressure on appointments. But remember, this mainly is for people that are not known to have high blood pressure. Contraceptive pill, all those people saying, "Oh, I've run out," or "I need to repeat prescription." Actually, you just direct them to the pharmacy. Emergency contraception, again, could be a really big flow. Are you still booking some of these in with your duty doctors or on day, or someone, a pharmacist? Even if you have pharmacists in the practice, can you still shift the workload to the community pharmacist by getting them to do that? And medicine service. This is the one I really don't think we use much, but again, if someone's having a difficulty with a query of medicine, you may be booking them in for someone to call them back, but could their community pharmacy help? Do you give them this link, say, "Look, do you want to try and talk to your community pharmacist about this?" And then come back to us if you still don't understand about the medication you've just been prescribed. We mentioned about lateral flow testing, flu vaccination.
We have another question in the chat.
Yeah.
It says, can we ask what about patients who have not consented to text messaging, who require an interpreter when being signposted, or have other health issues preventing them from speaking to reception, such as a disability?
So I'm going to maybe if I show you the communication annex in SystmOne. So first of all, none of this is all very digital and signposting. Now we can say all of this verbally as well. The links online definitely reduce the workload for practices and reception staff, that they've got an additional resource here. I think if you become more familiar, you can obviously say a lot of that. I think in reality, a lot of us signpost without even doing a link. So this is an additional resource that helps with that workload of communication. You can send them via email when you look at the communication annex and even Accurex. Well, Accurex not quite actually. You can also send it to another mobile phone number. That functionality exists in both TPP and Accurex. So if it's a carer, family member that you want to send it to, look, I'm not saying it's right, but I think in reality, people also get forward messages that they get to someone else to help translate it for them. And that can be a practical solution. Confidentiality I know is important, but if the patient chooses to send it to someone else, like family members, look, I got this message from the receptionist, I don't understand it, they might help act as a translator too. And obviously, the email, you can put them into things like browser translator services as well. But look, I completely agree. This is not for everyone, and not every patient will be suitable for this. And some patients I'm going to have to just see in general practice because we cannot manage the referral, the signposting to the pharmacist.
Okay, we have another question.
Yes.
For ABPM, do we pick BP check option on the service pathway finder, or is it safer to contact local practices to see if they can do ABPM?
Personally, I really do like that flow that I showed you with that link, because if the person can navigate that link, it accurately shows all the pharmacies that are signed up, does it? So you're really neutral. And remember, particularly this cohort over 40, we don't know exactly, their working patterns, where they feel is convenient from opening hours of the pharmacies. It resolves all that for you as well, because they can see all the opening hours for those pharmacies too. So personally, I would just send them that link and just let them navigate it. And I would direct them more if you felt that they cannot navigate it digitally, that you then may use Service Finder, or you could even use that. If you find it, you can't even have the time to log into Service Finder, you could just use the same link as imagine you're the patient and putting the patient's postcode in. So you could go to the NHS website if you don't even have to then log in. Those are practical ways that you do it. And I think in reality, you would know your common pharmacies around your practice that do offer it and how they work. So you probably don't even end up needing to check anything. Okay, so communication annex. If a practice has not got communication annex on the toolbar, please add it. Honestly, there's lots of reasons. I know Accurex is amazing, but there's lots of things that are starting to happen in this space, and lots of future developments. And in some ways, there's some ways it trumps it. I've created so many templates here that I've pushed to all the practices. Some of them may be rubbish and you need to feed back to me and I tweak them. A lot more we need to create. I cannot do that for you on Accurex. I have to get all of you to create them individually. So it's still about workload reduction. If I can manage this for you centrally across all 200 odd practices, I'm saving 200 practices maintaining those things. And I know things will go wrong. Contact details, messages will change, but we work as a team. You point out that one message is going wrong, I fix it live for all 200 practices. That's surely a better way of working. So everyone, stick this on your toolbar, get staff to realise it exists, and that there is a world outside of Accurex for certain things. But if you go into presets, you search for pharmacy, or you scroll down, you can see tons of the pharmacy preset messages that I showed you there. So you don't even need to build them. Hopefully you'd feel that they're all kind of usable and you just need to click on it. And those are the same sort of presets you can get from the template that I showed you earlier. So that's the reminder on how to do the toolbar addition. And some staff may be on individual control of their toolbar. So you might have thought you've added it to the practice toolbar, but some staff can't see it. So personally, that's why I kind of encourage that you have practice level. You try not to let individual staff customize their toolbar, but just make sure everyone's got it onto that. And this will prepare you for lots of other things that are coming in the future with NHS app messaging too. But if you did want to stick with Accurex, here's how you could practice set up similar things. So you can cut paste it out of the slides, set it up at practice level. You've got to add a correct code for it. I've tried to do that for you in the SystmOne messages, but there's a big problem. There's lots of SNOMO codes that we need. They really haven't yet created them for Pharmacy First. So some of the codes you may think they're inappropriate. They use things like, I'm still using things like refer to CPCS. Just think we add in some sort of code that might track something, and that the codes will probably change over time when we get them. Okay, we've covered kind of the community blood pressure service, but here's where you can get more details about it. But just remember, it's for over 40-year-olds without a diagnosis, so not for people that you're already known to have that diagnosis, and that they can do those ABPMs as well. It's not just about a single reading. And that's the link again to that where you can find pharmacies that do that. The contraception, I really do think we can use this more. So it's a similar process. You can get similar information. Patients can self-refer. They don't need to be referred, or we can refer them if we want. You could just even ping a pharmacy an email. It doesn't have to be a big form. We're working with all the online consultation providers, asking to build in increased signposting. I have monthly meetings with eConsult, started the journey last autumn. There are small things they're doing. Some of the messages that you see on the out of office will improve. Also, like UTI, you'll start to see the questions evolve. So if you got it, it will probably match more. They'll start to try and say things like consider pharmacy first at the top of your eConsult if they think it matches across. All the other providers, I know that not all of you are using eConsult. We're trying to have those conversations, but generally, it's still difficult for them. If you ask too many questions to map them, the experience for the patient is not great. So it will probably be more increasingly signposting that they suggest it rather than tell the patient it's absolutely the right thing for them. Okay, so I know we're running out of time, but the last two parts are a little bit quicker, so bear with me. We're now going to move on to receiving consultation. We're going to get a bit techie about this. At the moment, you're probably receiving things back from pharmacies by NHSmail, and I know that's a bit frustrating. You know, it goes into your workflow. You've got to do whatever you do with it. The future is something called GP Connect Update. So this is a bit of those technical jargon. GP Connect Update is when it will come directly into SystmOne. SystmOne is now already live with it. We've already covered it in some of the other IT forums with it. What we're waiting for, though, is not all 4 pharmacy IT systems are ready. So the delay is at the pharmacy end. And most of London pharmacies are on particular platforms that are not live. So you're just not really probably seeing it. If any of you have experienced it, it's just probably been a bit of luck that a random pharmacy that is not a typical one in London has had an encounter with that patient, but you probably haven't experienced it yet. Again, this is very technical and blurby, but what and I know we've got one EMIS practice. I've kept this slide for Dawn as well. I'm not going to cover this, but if you go for this link, you can see the EMIS experience. I will try to cover, though, the SystmOne experience. So first of all, if you want to know more information about how it's going to work in SystmOne, this is the SystmOne help page, but I'm just going to try and familiarize it. You'll start to see this come in as tasks like this when the pharmacy sends a report back. So that's how you're going to start to see it. And when it comes in, it's beautifully structured. It's going directly into the journal. So no more like document workflow, coding or anything like that. It's structured. So this is a big first. This is the first time we're going to sort of see this. It's using the functionality for the first time in pharmacy. And it will automatically provisionally file this. I know that sounds scary, but it's not confusing. A bit like how you may have set up 111 reports. It'll be visible in the tab journal, even if it'll flag if it still needs to be reviewed. So if a receptionist gets a phone call from a patient saying, look, I just saw the pharmacist and they tell me I need to come back to you, hopefully when a receptionist goes in, they'll already see a provisionally filed report when we get to that stage with that contact, and they can say, oh yes, I can see the pharmacist suggest this, we can deal with it. So even if there's chaos in how quickly the patient phones up and we didn't even action it, it should help with that whole workflow that it appears in the tab journal. And you're set up automatically that it will auto file that into the journal like that, so it's visible. I really recommend you keep the settings as it is, but you can adjust it if you wanted to in this setting here. I know that all seems like gobbledygook, but just think that you might just start to notice things come as tasks and stuff. I can't tell you exactly when, but it could even be over the coming weeks. Another major provider is going live, and the big one could go live in the coming week. So just have that familiarity so that you're not totally surprised when you start seeing it come in. We're going to now wrap up on the promotional materials. So I've shown you some of the bits that you might want to use. So really, we want to obviously promote it to the patient, so it does some of the workflows. They may even self-direct themselves there because we've got their materials. So here's the link for some of those materials that I've shown you. You can download them or add them to websites. You might print them off and use them as posters. This is their blood pressure one that they've launched. I actually don't think it's that great personally, but that's the blood pressure one that I've got. So you can again download it and use it if you want. This is the contraception link for services. Again, I think some of the resources are a bit dated, some of the posters. I'm not sure you may find them useful or not, but you know, they can help promote it. The pharmacy community pharmacy services, like the organisation Community Pharmacy England that represents the pharmacies, they've also created their own materials too. And some of those posters you may find useful. There's also things like that or versions like that you'll probably start to see pop up in the pharmacies because they're using that their materials too. Media screens, you are now all in control of your media screens. Most of you still allowed me to have some control of them. I have been pushing materials into your media screens if you still signed up with NewMed. But you could be using different providers now. So I have liaised with the two major companies, NewMed and JX. The materials are uploaded centrally, so you can add it to playlists in your media screens. So it saves you having to just upload it yourself. There's lots of social media stuff that's happening from GPs and influencers out there. So our patients are subject to that. So TikTok, yes, we're in the TikTok world now, and there's definitely obviously lots of influencers out there. And those are some of those materials that we've sort of looked at in the video that kind of promote that message. Okay, we're coming to the end. Now, these are promoting the blood pressure check services. This one I made up. Obviously, our current Prime Minister is the son of a pharmacist and son of a GP, and he did obviously try to promote the launch of the blood pressure check service as well. So that's something I used to make something as well. And some of the areas have created their own sort of promotional materials as well. So you could even see if any pharmacies or your PCN create something that's very localized as well. And finally, like in your community pharmacies, really, if they promote the NHS app, we start to join everything together. That it reduces our workload with repeat prescriptions. If patients go into the NHS app, they start to see these pharmacy services and flows. So we just start to connect the whole promotional campaign together. Okay, so what's the next steps? Awful lot to cover. This is going to clearly be a gradual process. We're going to have to keep updating on the best way to manage it. Some of the IT bits I've shown you now will date. And I just want to highlight one key thing with what I've shown you. SystmOne is likely to build a new referral process to community pharmacies that are using some national standards. It's something called BARS, called Booking and Referral Standard. It's NHS England technology or specification. The delays are probably more at the NHS England end than TPP end. This is one of the reasons why I'm still asking you to use all these workarounds. I really do think we probably all would benefit from that integrated solution SystmOne, and it'll be the quickest number of clicks and so forth. There are lots of other solutions that we could use, but often they're standalone platforms or going into putting information in manually. So I'm not keen for that. So bear with that journey. In the short term, though, don't just think about the IT. Look at the signposting. Look at that relationship with the pharmacies. Yes, things are not going to go smoothly all the time. Have those conversations and bring in the Ealing Borough we have a great medicines management team. Bring it to their attention if there's issues that you need clarifications. Bring it to your PCN. Try to build that momentum. See what works, what doesn't work. Really, just take it step by step. Okay, I'm going to close the presentation at that stage. I know we've got very limited time. I'm sorry. So in terms of questions, please do either come off mute and ask them or post them in the chat. We will probably repeat this webinar at some point in the future. It will probably be an even tweaked, improved version. And also because the technology will evolve as well. So any questions that we want to take now? Okay, so I'm not seeing any questions. The referral on SystmOne, yes, it's live. Everything I've shown you is live. It's been live actually for a few years because it's an evolution of what I did for CPCS. I've tweaked it a little bit further, literally even further tweaks today to try and optimize it, but it's live. That video that I showed you the link for, it's a walkthrough, quick video I made this morning, so it'll just walk you through it as well. We'll share that link in the slides.
Yeah, somebody asked whether they could have the slides sent over. We'll be putting the slides on the Ealing Training Hub website, and the link to that will be sent out in the Training Hub newsletter today.
I will hover if there's last minute questions in the chat, but I just want to say thank you everyone for attending, and I really hope that you have a pleasant afternoon. Bye.